So these cases we started to notice when we realized there were people going into their doctor's offices because they were having stomach complaints. And what is really interesting about this case is we detected it because of a collaboration across all of the United States. So as you can guess, a lot of people get sick to their stomach every day in Utah. That's normal. We know people get it, and it can be from a variety of things. It can be because of food they eat. It can be because of some bug they have caught from someone else. But we always look at those to see why they're getting sick, because we don't want to miss something that's causing people to get sick that we can change. So in this case, we go and we look at why people are getting sick, and we look at exactly what bacteria it is, and is there a link between different bacteria. So across the state, whenever anybody is sick enough to go to their doctor, we really encourage the doctor to test them to see what kind of illness they're getting. And in this case, it's taking a stool sample from that person and testing to see what bacteria or what virus is causing them to get sick. In Utah, we have a really good system so that when that sample is tested, we get the results automatically into our Department of Health and Human Services. The labs automatically send those results to us if they come up positive for any of those really concerning bacteria or viruses. And this is a case where they did come through. The outbreak that recently occurred was because of E. coli. And our state has it so that labs tell us when they get a positive E. coli in these people's stool samples so that we can look and see, is there anything in common between them? So the information we get from people about where they ate and what the bacteria is very vital. But you can imagine we really want to get the actual cause, and we want to be able to trace it back and say, look, this is definitely what caused this illness. And the way we do that is we actually go and test samples at the places where we think these infections have occurred. So in this case, it would be going to these McDonald's locations and taking some of the food samples from them to see if we can find the same E. coli. But we'll do this in all sorts of outbreaks. It might be when you have something where you ate something in your house and you think it's related to that specific product, we might ask you to give us a little sample of that product so that we can see whether or not the bacteria is there. And these data really come together to give us a full picture. It's the same bacteria, you were eating in the same place, and then we can say, look, it is actually in the food that was served there. And it helps us make a really good story that almost as good as CSI, where we can say, this is the smoking gun and this is what caused people to get sick. So as soon as we see something happening in our testing results that come in from the labs, we start looking into what those people have done. And we have a system where we reach out. It's either the Department of Health and Human Services or it's our local health departments. We'll call all those people who've gotten sick to see if there's something that they were exposed to that might be common between them. And they do a very extensive interview where we really ask people about what they ate, where they ate, who they ate with, are other people sick around them, so we can start to see, is there any pattern that is causing people to get sick that is a similar cause. In this case, we found a lot of people telling us that it was McDonald's, and we were able to start to understand that this might be the cause. But that's not the end. We really want to dig deeper than just having people tell us where they eat. We want to know whether or not one specific bacteria is causing multiple people to get sick. And in this case, we did. We found that E. coli that got people sick here in Utah was also getting people sick in Colorado and a number of other places around the United States. So it was exactly the same bacteria that was causing different people to get sick in different states. So there was something in common, and we knew we needed to dig further. So usually we get the results from the laboratory from somebody's stool sample. We get those very, very fast. But it takes a little longer to go and get that whole genome sequencing to know exactly what that E. coli pattern is like. And that usually takes 3 to 4 days to be able to do that. That information immediately uploads into a national database, and the database routinely, I think automatically, screens to make sure there's no matches across the country. But overall, these things often can be detected within a week, if not faster, depending on how many people are affected. We would have not had that ability to say this is exactly the same bacteria. And that would have limited our ability to say for sure that they were linked and for sure that this was one outbreak that was causing all these people to get sick.